Artificial intelligence is affecting so many parts of our lives in ways both seen and unseen, and that includes healthcare. And while AI has the potential to improve care and save lives, some say it's actually putting a barrier between them and the medicine they need, stigmatizing them and leaving them in lasting pain. Artificial intelligence is transforming medicine, but not everyone says that change is for the best. In fact, some uses of AI are at the center of controversy.
These systems are judging you by an algorithm.
Brandy Novica is an advocate for patients in pain. This is a battle she knows firsthand.
The first time I complained of back pain, I was 8 years old. And that's when it was discovered that I had scoliosis.
Looking at Brandy, you wouldn't know her spine has two pronounced curves. It's a lifelong battle, and she has the scars from 8 surgeries to prove it. Today, do you live with pain?
Every day.
Brandy says patients like her face unnecessary challenges accessing the powerful pain medications they need just to function. And it's in part because of the AI-driven Narxscores used by states to identify potential abuse. Scores are based on a number of factors, including the number of medical prescribers, the number of hits on pharmacies, the kind and strength of medicines, and overlapping prescriptions. With a severe spinal curvature and exhausting non-opioid pain meds, Brandy relies on hydrocodone. Finding someone to manage her pain, she says, has been difficult.
I was being bounced around to so many doctors, and that was going against me. Like I was doctor shopping. It has been a nightmare here. An absolute nightmare.
The report is as good as the data that you have.
Dr. Elizabeth Boulite, Medical Director of Addiction Services at Henry Ford Health, says Narxscores are useful in identifying cases worth a closer look.
Need to identify those at risk for potentially a substance use disorder or overdose potential.
That potential from overdose could come from a prescription the patient simply forgot about. Dr. Boulite says there is a role for Narxscores in patient care, but adds that algorithms can't replace human judgment. For instance, if someone has 2 prescribers,
this could be somebody that recently moved or relocated, or their prescriber was out of town and they had to find another.
Brandy believes Narxscores should be scrapped and says the system has many doctors afraid to prescribe medicines even when it's appropriate. She calls the system a tool for law enforcement.
Pain patients aren't criminals. Like my crime is being born with a bad spine.
Artificial intelligence and machine learning aren't going away, so the goal has to be to find a way to minimize the negative impacts. Now, Brandy is taking part in a Don't Punish the Pain rally this morning at 10 a.m. at the DEA's headquarters in Detroit. Now, tomorrow I'm going to take a look at how AI is saving lives by saving minutes when every second counts.